Hello, nursing fans. Today we are going to talk about nursing care of patients with cancer, and this is Chapter 11 in Med-Surg. One thing I really like is that the main concept for this chapter is comfort. And this is page 142 of the 6th edition of Understanding Medical Surgical Nursing. And this chapter begins with a review of anatomy and physiology of normal cells. Cells are the smallest living structural and functional subunits of the body. Although human cells vary in size, shape, and certain metabolic activities, they have many characteristics in common. Cell structure. Human cells have a plasma membrane, cytoplasm, including cytosol and organelles, and a nucleus. Organelles are specific in structure and function. Variations in the relative amounts of organelles and cell features allow great diversity in cells and therefore in tissues. Nucleus. The nucleus of a cell is its control center, containing the individual's unique deoxyribonucleic acid sequence, DNA. Most cells have one central nucleus, although variations exist. DNA coding regions are called genes. A gene is the code for one protein. Not all genes in a particular cell are active, rather only those needed for the proteins required to carry out their specific functions. These proteins may be structural, such as the collagen of connective tissue, or functional, such as the hemoglobin of red blood cells. Important functional proteins are the enzymes that catalyze the specific reactions characteristic of each type of cell. Genetic code and protein synthesis. The genetic code of DNA is the code for the amino acid sequences needed to synthesize a cell's proteins. The assembly of the amino acids into the primary structure of a protein is a two-step process: transcription and translation. Transcription makes a copy of the code needed for a protein so the DNA can remain guarded in the nucleus. Translation occurs at the ribosome, where the nucleotide code of nucleic acids is translated into the amino acid code of protein. As with any complex process, mistakes are possible. If there is a mistake in the DNA code, the process of protein synthesis may continue. However, the resulting protein will not function normally. This is the basis for genetic diseases. DNA mistakes acquired during life are called mutations. A mutation is any change in the DNA code. Ultraviolet rays or exposure to certain chemicals may cause structural changes in the DNA code. These changes can kill the affected cells or may irreversibly alter their function. Such altered cells can become malignant, being unable to function normally. These cells actively replicate the mutated DNA during division, creating a mass of faulty cells. This is the basis of some forms of cancer, which is a general term for many types of malignant growths. Mitosis. Mitosis is cell reproduction. After its 46 chromosomes have replicated, one cell divides into two cells, each with a complete set of chromosomes. Mitosis is necessary for the growth of the body and the replacement of dead or damaged cells. Not all cells are capable of mitosis. Of those that are capable, the rate of division varies widely by tissue type. Some cells are capable of only a limited number of divisions. Once that limit has been reached and the cells die, they are not replaced. Shortly after birth, almost all neurons lose their ability to divide, and the muscle cells have limited mitotic capability. When such cells are lost through injury or disease, the loss of their functions in the individual is usually permanent. Cell cycle. The cell cycle involves a series of changes through which a cell progresses, starting from the time it develops until it reproduces itself. The duration of the cell's life, the time it takes for mitosis to occur, the growth ratio, the percentage of cycling cells, and the frequency of cell loss and the doubling time, the time for a tumor, an abnormal mass, to double its size, are important concepts related to tumor growth and treatment strategies. At any point in time, some cells are actively dividing, leaving, others leave the cycle after a certain point and die, and still others temporarily leave the cycle and remain inactive until re-entry into the cycle. Inactive cells continue to synthesize ribonucleic acid, RNA, and protein. Cells and tissues. A tissue is a group of cells, of like cells, of the same structure and function along with their intercellular substance. The four categories of human tissues are epithelial, connective, muscle, and nervous. Tissues organize into organs. Organs construct systems, and systems form the individual. Because of this hierarchy, if a dividing mass of cells is mutated, the abnormality will produce symptoms at the higher levels. Introduction to cancer concepts. Oncology is the main branch of medicine that deals with the prevention, diagnosis, and treatment of tumors or malignancies. Oncology nurses or cancer nurses are an important part of the medical surgical team, providing care for patients from prevention and detection to treatment, follow-up, and palliation. The American Cancer Society, ACS, reports more than 15.5 million Americans alive today have a history of cancer. The benefits of early cancer detection and treatment have been documented since the beginning of the 19th century. Today, microscopic technology, genetic testing, and continued research provide healthcare providers with a better understanding of cancer and means for early detection, interventions, and care. Box 11.1 lists some helpful cancer resources. Benign tumors. Cells that reproduce abnormally result in neoplasms or tumors. The term neoplasm can be used to describe both cancerous and benign tumors. A benign tumor is a cluster of cells that is not normal to the body but is non-cancerous. Benign tumors grow more slowly than cancer cells. They do not alter the cells of the original tissue. An organ containing a benign tumor usually continues to function normally. A neoplastic growth is difficult to detect until it contains about 500 cells and is about 1 centimeter in diameter. Cancer. Cancer is a group of cells that grows out of control and eventually takes over the function of the affected organ. Cancer cells are poorly constructed, disorganized, and fast growing. Malignant, a term often used to describe cancer, means that the tumor can invade surrounding tissue, spread throughout the body, and threaten life unless treated. Table 11, see Table 11.1 for a comparison of benign and malignant tumors. Nursing care tip. Teach patients and families that cancer is not contagious. Pathophysiology. Cancer is not one disease, but many diseases with different causes, manifestations, treatments, and prognosis. There are more than 100 types of cancer. Normal cells are limited to about 50 to 60 divisions before they die. Cancer cells, however, do not have a division limit. They are considered to be immortal. They can continue to grow out of control until they are destroyed. So Box 11.1 shows some of the cancer resources such as the American Cancer Society, cancercare.org, the National Cancer Institute, the Oncology Nursing Society, and Centers for Disease Control and Prevention, the CDC. The progression from a normal cell to a malignant cell follows a pattern of mutation, defective division, abnormal growth cycles, and defective cell communication. Cell mutation occurs when an alteration affects the chromosomes, causing the new cell to differ from its parent cell. The malignant cell's enzymes destroy the glue-like substance found between normal cells. This disrupts the transfer of information and communication used for normal cell structure and growth. So Table 11.1 compares the benign and malignant tumors. So benign tumors have a typically slow expansion on their growth rate, whereas malignant tumors often have rapid growth and malignant cells infiltrate surrounding tissue. For benign cells, the cell features typical of the tissue of origin, whereas malignant cells have cell features that are atypical in varying degrees compared with the tissue of origin. Maybe an altered cell membrane and contain tumor-specific antigens. For benign tumors, you may have minor tissue damage, whereas for malignant tumors, the tissue damage, the cancer often causes necrosis and ulceration of tissue within the body. For benign tumors, metastasis is not seen because the benign tumor is localized at the site of origin, whereas malignant tumors, they often spread to form tumors in other parts of the body. For benign tumors, they seldom recur after surgical removal. However, malignant tumors can be seen after surgical removal and following radiation and chemotherapy. For benign tumors, some of the related terminology would be hyperplasia, polyp, and benign neoplasia. If you're talking about malignant tumors, some of the terminology would be cancer, malignancy, as well as malignant neoplasia. Those all mean the same things. Those are very related. The prognosis for a benign tumor is generally not injurious unless the location causes pressure or death if uncontrolled. If uncontrolled obstruction to vital organs occurs. So they actually didn't list, wait a minute. not injurious unless location causes pressure or obstruction to vital organs. Okay, whereas malignant tumors, the prognosis is death unless the tumor can be controlled somehow. So, cancer cells also lack contact inhibition. Growth regulating signals in the cell's surrounding environment are ignored as the abnormal cell growth increases, and the cells continue to divide and invade surrounding tissues. Etiology. Cancer cell growth and reproduction involves a three-step process: initiation, promotion, and progression. The first step, initiation, is the result of an alteration in the genetic structure of the cell, the DNA. This occurs either spontaneously or following exposure to a carcinogen, which is a substance or agent that increases the risk of cancer. The cellular change primes the cell to become cancerous. Promotion occurs after repeated exposure to carcinogens causes the initiated cells to mutate. During the promotion step, a tumor forms from mutated cell reproduction. During progression, further genetic mutations occur, leading to growth and metastasis. Scientists are now using their understanding of cancer cell growth to develop treatments aimed at harming the cancer cells at their various stages of formation. A healthy immune system can often destroy cancer cells before they replicate and become a tumor. It is important to remember that any substance that weakens or alters the immune system puts the individual at risk for cell mutation with the potential to develop into cancer. Risk factors. Viruses. Certain viruses, such as oncoviruses, which are RNA type viruses, are linked to cancer in humans. These viruses insert their own RNA into the host cell, causing a mutation with the ability to produce a cancer. Understanding oncoviruses has led to the development of vaccines to prevent these cancers. The Epstein-Barr virus, EBV, which causes infectious mononucleosis, is associated with Burkitt lymphoma and nasopharyngeal cancer. Herpes simplex virus type 2 is associated with cervical and penile cancers. Human papillomavirus, HPV, is associated with cervical and vaginal cancer in women, penile cancer in women and men, cancer of the anus, and some head and neck cancers in both sexes. Vaccination against HPV Gardasil is recommended for girls and boys aged 11 to 12. Chronic hepatitis B is linked with liver cancer. Radiation. An increasing incidence of cancer occurs in persons exposed to prolonged or large amounts of radiation. Ionizing radiation involving ultraviolet rays, e.g., sunlight, X-rays, alpha, beta, and gamma rays, plays a role in promoting leukemia and skin cancers, primarily melanomas. Persons exposed to radioactive materials in large doses, e.g., a radiation leak or an atomic bomb, are at risk for leukemia and breast, bone, lung, and thyroid cancer. Controlled radiation therapy is used to treat cancer patients by destroying rapidly dividing cancer cells, but radiation can also damage normal cells. The decision to use radiation is made after careful evaluation of the tumor's location and vulnerability to other treatments. Cultural considerations. Many racial and ethnic groups in the United States have high rates of cancer. Although risk factors for the development of specific cancers are similar, barriers to prevention and nursing strategies to reduce risk factors vary among races and ethnicities because of differences in receiving or timeliness of recommended treatments. Non-Hispanic white, foreign born, and first generation white men from Norway, Sweden, and Germany have an increased risk of stomach cancer. Be sure to assess for dietary risk factors. Recent Eastern European immigrants may be at risk for thyroid cancer and leukemia because of industrial pollution and radiation exposure from the Chernobyl nuclear disaster in the former Soviet Union in 1986. Some contamination occurred in Estonia, Latvia, Lithuania, and Poland. It is essential for healthcare providers to carefully screen individuals for these cancers. Non-Hispanic Black African Americans. The risk of death after a diagnosis of cancer is higher for non-Hispanic Blacks for all cancers combined and for most cancer sites. In general, African Americans report later for treatment than non-Hispanic whites. Lower levels of thiamine, riboflavin, vitamins A and C, and iron may increase cancer risk. Hispanic. Hispanic populations in the United States have an increased incidence for some types of cancer, most notably leukemia. However, they have a lower risk of death after diagnosis for lung and cervical cancers. Asian American slash Pacific Islander. Although Asian Americans slash Pacific Islanders have a higher risk of death than non-Hispanic whites for all cancers, they have a lower risk for some common cancers. Asian Americans slash Pacific Islanders have a higher risk of death for oral cavity cancer and melanoma, non-Hodgkin's lymphoma, and leukemia. High rates of stomach, breast, colon, and rectal cancer are common among the Japanese, may be related to a genetic predisposition, hepatitis B, vitamin A deficiency, low vitamin C intake, and chronic esophagitis. Arab Americans are at risk for lung cancer and other cancers related to smoking. Rates of breast cancer screening and cervical pap smears are low among Arab American women. American Indian populations have an increased risk, most notably for leukemia and thyroid cancer. Risk factors for the development of cancer include obesity, a diet high in fat, and high rates of alcohol consumption and smoking. Chemicals. Chemicals are present in the air, soil, water, food, drugs, and tobacco smoke, as well as in the households. We are using chemicals all over the place now to fight COVID-19. And these are very risky, not just to the COVID, but to us as well. Chemical carcinogens are implicated as triggering mechanisms in malignant tumor development. Length of time and degree of exposure intensity to chemical carcinogens are associated with risk for cancer development. Smoking accounts for 30% of all cancer deaths in the United States and 80% of lung cancer deaths. Alcohol and tobacco together increase risk factors. They are the most frequent causes of cancers of the mouth and throat. Heavy use of alcohol has been associated with liver, breast, colon, and pancreatic cancers. Occupational exposures are associated with some cancers such as bladder, liver, kidney, lung, and skin. The development of federal and state employee protection regulations has significantly reduced the risk of occupational exposures. Irritants. Chronic irritation or inflammation caused by irritants such as snuff or pipe smoke often cause cancer in local areas. Nevi or moles that are chronically irritated by clothing, especially clothing contaminated by chemical residue, can become malignant. Asbestos found in temperature and sound insulation has been proven to cause a particularly destructive type of lung cancer. Genetics. Genetics play a large part in cancer formation. Certain breast cancers are linked to a specific gene mutation. Skin, colon, ovarian, and prostate cancers have a genetic tendency. People with Down syndrome, a chromosomal abnormality, have a higher risk of developing acute leukemia. Diet is a major factor in both cause and prevention of malignancies. People who eat high fat, low fiber diets, like fast food, are more prone to develop colon cancers. High fat diets are delicious as they are linked to breast cancer in women and prostate cancer in men. Consumption of large amounts of pickled, smoked, and charbroiled foods has been linked with esophageal and stomach cancers. A diet low in vitamins A, C, and E is associated with cancers of the lungs, esophagus, mouth, larynx, cervix, and breast. Hormones. Hormonal agents that disturb the body's balance can also promote cancer. Long-term use of the female hormone estrogen is associated with cancer of the breast, uterus, ovaries, cervix, and vagina. It has been found that children born of mothers who took DES, dithylstilbestrol, during pregnancy have an increased incidence of reproductive cancers. DES is a synthetic hormone with estrogen-like properties that was used in the past to prevent miscarriage. Tumors of the breast and uterus are tested for estrogen or progesterone influence. Treatment varies depending on the test results. This is page 148 in the book in chapter 11. Immune factors. A healthy immune system destroys mutant cells quickly on formation. An individual with impaired immunity is more susceptible to cancer formation when exposed to small amounts of carcinogens compared with someone with a healthy immune system. Immune system suppression allows malignant cells to develop in large numbers. Altered immunity is noted in persons with chronic illness and stress. An increased risk of cancer follows a traumatic, stressful period in life, such as the loss of a mate or a job. Failure to decrease stress productively contributes to a higher incidence of chronic illnesses. Thus, a cycle of stress, illness, and increased cancer risk develops. People with AIDS have a compromised immune system and an increased risk for certain cancers. People on medication that reduces immune function are at risk. A decline in the immune system and an increase in cancer risk are noted as the body ages. Cancer classification. Cancers are identified by the tissue affected, the speed of cell growth, cell appearance, and location. Neoplasms occurring in the epithelial cells are called carcinomas. Carcinoma is the most common type of cancer. It arises from cells of the skin, GI system, and lungs. Sarcomas are cancer cells affecting connective tissue, including fat, the sheath that contains nerves, cartilage, muscle, and bone. Leukemia is the term used to describe the abnormal growth of white blood cells. Cancers involving cells of the lymphatic system, lymph nodes, and spleen are called lymphomas. See Table 11.2 for cancer types based on origin. And we just basically reviewed these, but they have them set up here in a table, and they're explaining that the tumor type fibroma and lipoma, those are both benign. The fibroma has an origin of connective tissue, and the lipoma has an origin of fat tissue. Then these other tumors are cancerous. The carcinoma is a tissue of the skin, glands, and digestive, urinary, and respiratory tract linings. Leukemia is going to be blood, plasma cells, and bone marrow. And then lymphoma is lymph tissue of origin. And then melanoma, of course, the origin would be the skin cells. And for a sarcoma, the origin is connective tissue, including bone and muscle. Metastasis, or spread of cancer. Neoplastic cells that remain in one area are considered localized or in situ cancers. These tumors may be difficult to detect on clinical examination. They are identified through microscopic cell examination. In situ tumors are often removed surgically and may require no further treatment. Metastasis is the term used to describe the spread of the tumor from the primary site into separate and distant areas. Metastasis occurs mainly because cancer cells break away more easily than normal cells. Cancer cells can survive for a time independently from other cells. There are 3 steps in the formation of a metastasis. Cancer cells, 1, invade blood or lymph vessels. 2, they move by mechanical means. And 3, they lodge and grow in a new location. Metastatic tumors carry with them the cell characteristics of the original or primary tumor site. As a result, surgeons are able to determine the original tumor site based on metastatic cell characteristics. For example, lung tissue found in the brain suggests a primary lung tumor with metastasis to brain tissue. Common sites of metastasis are the lungs, liver, bone, and brain. Incidence of cancer. Cancer affects all age groups, but has the highest incidence in older people. In the United States, 87% of all cancers diagnosed are in people 50 years and older. Men have a higher incidence of cancer than women. Cancer in people over age 50 is thought to occur from a combination of exposure to carcinogens and weakening of the body's immune system. Acute lymphocytic leukemia and cancers of the central nervous system and brain are common cancers found in children aged 0 to 14 years. Causes of childhood cancer are not understood, therefore, prevention is difficult. Genetic predisposition is a factor. The most common type of cancer in adults is skin cancer. It is also considered to be the most preventable. Exposure to ultraviolet radiation, sunlight, and indoor tanning increases the risk of skin cancer. Wearing protective clothing and sunscreen can greatly reduce the risk of skin cancer. Lung cancer has the highest cancer mortality rate in both men and women. It is also commonly preventable. Cigarette smoking is the main cause, along with air pollution and exposure to radon and other chemicals. Men have a high incidence of prostate cancer between the ages 60 and 79. Cancer of the colon and rectum has been linked to consumption of high-fat, low-fiber diets. It ranks the third highest cancer in men and women. The highest incidence of cancer in women is in the breast. Women with a family history of breast cancer have a greater risk than those with no family history. Commercial testing for the oncogene linked with breast cancer is available and marketed for high-risk women, especially those in Ashkenazi Jewish population. Genetic testing is done through genetic counseling programs. Cost ranges from $400 to $4,000. It may be covered by some insurance plans if certain risk criteria are met. And figure 11.8 shows estimated new cancer rates and deaths for 2017. Mortality rates. Cancer survival rates have improved with the recognition of risk factors and improvements in early detection and treatment. A 5-year period is used to monitor patients' prognosis following diagnosis and treatment. Survival statistics are based on those who live 5 years in remission. Remission is considered to have occurred when all signs and symptoms of cancer have disappeared, even though there may still be cancer in the body. Early detection and prevention. Nurses play an important role in preventing and detecting cancer by educating patients about risk factors, self-examination, genetic testing, and cancer screening programs. Early diagnosis and treatment are important factors in fighting cancer. Early detection. Regular physical examinations help HCPs detect early warning signs of cancer. The ACS recommends mammography, a special X-ray of breast tissue used to detect a mass too small for palpation, every 1 to 2 years in women after age 45. Screening should continue as long as the woman is in good health and has a life expectancy of 10 years or more. Women should discuss individual risk factors and recommended screenings with their HCP. Initial panicolo Pap testing for cervical cancer is recommended to begin no later than age 21 and be performed every 3 years up to age 29. The preferred approach for women aged 30 to 65 is to have the Pap test with an HPV test every 5 years. However, it is acceptable to just have the Pap test every 3 years in this age group. After age 65, a woman who has had 3 normal Pap tests in a row within the past 10 years can choose to stop screening. That is really something to look forward to. Some women choose not to be screened even when they have access to health care. Barriers to screening include fear of healthcare personnel and testing procedures, as well as lack of knowledge. Women who fear cancer but trust their HCPs and seek information are more likely to be screened. As a nurse, you can help by developing a trusting relationship and providing information to your female patients. The ACS considers monthly breast self-examinations to be optional for women and testicular self-examinations to be optional for men. ACS guidelines encourage everyone to be familiar with their bodies and to report changes to their HCPs. Offer men and women instruction in breast and testicular self-examinations. The ACS recommends one of the following options to screen for colorectal cancer beginning at age 50. So tests that find polyps and cancer include a flexible sigmoidoscopy every 5 years, which is a camera that goes through your anus and into the colon, a colonoscopy, but it doesn't go, I don't think it goes that far into the colon, but then there's the colonoscopy every 10 years, which I believe would be basically snaking a camera through the entire colon, large intestine. And then they're recommending a double contrast barium enema every 5 years and a colonography, which is a virtual colonoscopy using CT every 5 years. I wish the book would explain which one of these involves radiation because I think that's important. Also, this barium is very harmful to the kidneys, and I know that CT scans do involve radiation, as do the mammograms that are being recommended here. Tests that mainly find cancer would be a fecal occult blood test every year and a fecal immunochemical test every year. Also, a stool DNA test every 3 years. And if any tests are positive, a colonoscopy should be done. Before 2009, the ACS recommended annual digital rectal examination and a PSA antigen, prostate specific antigen blood testing for men aged older than 50 years of life with an life expectancy of at least 10 years, and for younger men at higher risk. The ACS currently recommends that men discuss the benefits of PSA testing with their HCP starting at age 50. It seems reasonable, however, to still offer these tests as options to men in these populations. Blood testing. A new blood test called CancerSeek was introduced in 2018. This test can help detect 8 different cancers before any symptoms occur. It is unclear how this test will be used, but it is very promising because early detection can be critical for successful treatment. Genetic testing. Genetic testing is used to identify persons believed to be at risk for certain cancers. Genetic testing technology poses both legal and ethical questions regarding confidentiality and insurance issues. The cooperation of family members is important because genetic testing is done after a family member has been diagnosed with cancer. Family members may experience a variety of emotions surrounding the increased risk, potential risk for themselves, as well as guilt over the role they may have played in increasing risk for their children. Healthy lifestyle. Promotion of healthy lifestyles, including proper diet and exercise, helps strengthen the immune system and reduce cancer risk. Smoking is the most preventable cause of death from lung cancer. Smoking cessation is the subject of ongoing campaigns by the ACS. Secondhand smoke contributes to a significant increased risk of lung cancer in non-smokers as well. And there's also something called third-hand smoke, which would be the residue that remains from secondhand smoke on walls and items and anything exposed. So that can also be cancerous. Protected foods. Much research related to diet and cancer risk is being conducted. Visit cancer.org and Nutrition Notes Reducing Cancer Risk for additional dietary recommendations. Vaccinations. Vaccines, preventive vaccines target viruses associated with certain cancers. Recombinant HPV vaccine, Gardasil, for example, prevents HPV, which is responsible for certain cancers. Hepatitis B vaccine protects against the infection that increases susceptibility to liver cancer. Therapeutic vaccines are currently being researched and tested for various cancers. These vaccines stimulate the patient's immune system to destroy cancer cells. Currently, the only therapeutic cancer vaccines approved by the U.S. Food and Drug Administration are Provenge for the treatment of advanced prostate cancer and Temilogene laherparepvec, TVEC, for metastatic melanoma that cannot be surgically removed. Nutrition notes. Reducing cancer risk. The American Cancer Society estimates that the two-thirds of Americans that are overweight or obese, that two-thirds are obese. That is increasing the risk of many types of cancer. The World Cancer Research Fund estimates that about 20% of all cancers diagnosed in the United States are related to body fatness, physical inactivity, excessive alcohol consumption, and poor nutrition. The ACS recommends that Americans achieve and maintain a healthy weight. Eat a healthy diet with an emphasis on plant foods. Read food labels to be aware of portion sizes and calories. Choose whole, unprocessed fruits and vegetables. Limit the intake of sugar-sweetened beverages. Limit processed and red meats. Choose fish, poultry, or beans. Eat a variety of at least 2.5 cups of fruit and vegetables each day. Choose whole grains instead of refined grain products. Limit alcohol intake to 1 drink for women and 2 for men per day. That would be 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of distilled spirits. Diagnosis of cancer. A cancer diagnosis is a frightening experience. Often, people try to mask symptoms because they are so frightened of the disease. A physical examination, along with careful and thorough assessment of the patient's current status, medical and surgical histories, and pertinent family history should be completed. The most conclusive information is obtained through tissue biopsy. For explanations of the following tests, see Appendix A, biopsy. An accurate identification of a cancer can be made only by biopsy. A biopsy can be done via an endoscopic procedure, surgical incision, or a small needle inserted into the site. A biopsy can be done via an endoscopic procedure, a microscopic examination of sample of suspected tissue or aspirated body fluid can confirm the presence of abnormal or cancerous cells. A biopsy is commonly done in an HCP's office or an outpatient surgery department. Radiological procedures. X-ray examination is a valuable diagnostic tool in detecting cancer of the bones and hollow organs. Chest X-ray examination is one diagnostic test used in detecting lung cancer. Mammography is a reliable and non-invasive low radiation X-ray procedure for detecting breast masses. Patient perspective. Nikki, when I was 27 years old, I went for a routine checkup. The doctor found a lump in my right breast. I had noticed it 6 months before, but I didn't think it was anything. When the doctor told me it was cancer, my reaction was, why me? I have such a healthy lifestyle. I discussed treatments with my doctor, and he said I needed surgery, chemotherapy, and radiation. But because I was so young, I didn't want to lose my breast or my hair. The doctor said there was a new medicine that wouldn't make me lose my hair, but it wasn't covered by insurance. The doctor put a port in my chest for chemo. It was so painful. I cried. After 2 chemo treatments, I had surgery. They were able to remove all the cancer and still leave most of my breast. When I was in the hospital, all the young medical students had to look at my breasts. After a while, I stopped feeling embarrassed. Fortunately, my father was able to help me pay for the medicine I needed. When I went for chemotherapy, everyone was together in a group. All the older people looked at me because I was always the youngest patient. They had all lost their hair and had hats on. I lost about 20% of my hair, but I was the only one who could tell. Also, my skin got very dark, and people would ask if I went to the beach. I am Taiwanese, and people in Taiwan value light skin. I did not like being asked why I was so dark. I had 4 more chemo treatments and 30 radiation treatments. I started on tamoxifen to prevent the cancer from returning. About 9 months later, when I was 28, I moved to Japan. I knew I wanted to have a baby someday, but I wasn't worried at that time. Even the doctor wasn't sure whether I could have a baby. I met my husband, an American, when I was in Japan. I worried about telling him about the cancer because I knew he wanted children someday. But he said it was okay and that we could adopt if I couldn't have a baby. After we married, I stopped taking tamoxifen and had to wait 6 months to try to get pregnant. Then it only took 2 months to get pregnant. I now have a healthy baby and I feel very lucky and happy. I worried that I wouldn't be able to breastfeed my baby, and it turns out I can only feed him from my left breast. Now, when my breast is full of milk, I'm very lopsided. I have had to put in a pad on the right side when I go out. My left breast makes more than enough milk for my baby. I'm not sure how long I will breastfeed before I have to go back on the tamoxifen, but for now I'm happy that everything is working just fine. Nothing is more important to me than staying healthy, and for my husband and baby to be healthy too. Now I have a good life and healthy body, and I can take care of my family. To stay healthy, I am very careful to eat lots of fruits and vegetables and not to eat unhealthy fats, and I try to exercise a lot. Okay, we have just finished the patient perspective. That's on page 151 in the book. So what I would like to do now is take a look at this video from slide 6. I think you'll enjoy it.
Normal cell to a cancer cell. Take 5 minutes to get the picture. More than 60,000 billion cells make up the human body. They are the units that form the tissues which make up our organs, like the liver, heart, and lungs. When the body needs it, our cells split into two and replace those cells that are defective or have come to the end of their lifespan. This makes it possible for our tissues to preserve their shape and their respective functions with the passage of time. Every cell is therefore programmed to multiply and die. This ordered but complex program is controlled by the center of the cell, the nucleus, which contains chromosomes containing many genes made up of DNA. Sometimes, some of these genes undergo a change. The nucleus then sends out abnormal orders and the cell goes wrong. It multiplies uncontrollably and takes on a life of its own. Each new cell produced contains the same defect. The cells proliferate chaotically and form a tumor. This process may be short, but is often long. 10 to 30 years may separate the birth of a first abnormal cell from the appearance of a tumor of about 1 cubic centimeter. The tumor forms many blood vessels in order to survive. These will supply the tumor with oxygen and nutriments, allowing it to live and grow. This is what we call the phenomenon of angiogenesis. The tumor, however, only really becomes dangerous when the cancerous cells begin to invade through the vessels into the adjacent areas and spread to the surrounding organs. These cells can then invade other parts of the body, multiply and produce new tumors. Metastasis is the term used for this spreading process. But why does a cell become cancerous? There are many factors, and they can exist to different degrees. Factors have been identified, such as hereditary genetic anomalies, exposure to some viruses, HIV, hepatitis B, C, and D, papillomavirus, Epstein-Barr virus, exposure to toxic agents, chemical products, radiation, sun, unhealthy behaviors, such as the consumption of alcohol and tobacco, or a diet too rich in fat and low in fruit and vegetables. Today, over 25 million people in the world live with cancer. 7 million die from it each year. The disease represents the leading cause of mortality for those under 65. Lung cancer is the most widespread, followed by breast cancer, colorectal, stomach, and prostate cancer. The means to combat cancer do, however, exist. These often complementary treatments are used alone or in combination according to the type of cancer and its status. The goal of the treatments is to make it possible to eliminate the tumor and cure the patient in early-stage cancer, or like a chronic disease, to control its development. There are mainly 3 kinds of treatment. Surgery consists of removing the tumor in part or in its entirety. Radiotherapy exposes the tumor to radioactive rays, which prevent the diseased cells from multiplying and destroys them. Chemotherapy consists of administering systemic medicinal substances to destroy the cancerous cells or prevent them from spreading. Chemotherapy and radiotherapy act on cancerous cells, but also on healthy cells, which explains their side effects. But today, better knowledge of the characteristics of cancerous cells makes it possible to develop therapies that target the cancer development mechanisms more specifically. Sanofi Aventis R&D is already present in all these areas to fight against cancer on all fronts.
Okay, so this is the end of part 1 of chapter 11, and I will begin part 2 where it says contrast media X-ray studies on page 152. Thanks for listening.